degree from American University of Antigua and went on to complete his internal medicine and a fellowship in gastroenterology at Maimonides Medical Center, where he also served as chief fellow. After graduating in 2018, he worked in different private and multidisciplinary groups and is now a partner at Newtown Gastroenterology. Dr. Tian, welcome.
Thank you, Dr. Wang. Thank you, Dr. Wang, and good evening or good afternoon, everybody. Always a pleasure to be here, Dr. Wang. Thank you for the invite, and happy Easter, everyone, and happy Physicians Week. So I'm tasked with giving the pros and cons of group practice. As Dr. Wang may have mentioned already, that I have most of my experience in group practice, single specialty and multi-specialty. So to really understand group practice, we need to see what the other options we have are. So of course, there's private practice. So private practice, this is the traditional practice that most of us Chinese Americans are accustomed to, especially our parents. So in private practice, you call all the shots, you make all the decisions, you hire your billing manager, you hire your office manager. So anything from A to Z you're responsible for. And then for group practice, so this could include 2 or more physicians, single specialty or multi-specialty. And this is what we'll be talking about later. And then of course, there's hospital employed as well. So if you're into more clinical research, if you're into maybe a better work-life balance, hospital employee may be the right option for you. And then, of course, there's locum tenens, which is always something fun in my mind. I usually get emails from places like New Zealand and the Virgin Islands, and I got an email 2 weeks ago for a Disney cruise job. So that was pretty makes you think twice. Okay, so this is a graph that shows the percent of physicians working in a private practice wholly owned by physicians. So over the last decade, you can see that there has been a drop. So in 2012, it was 60.1%, and as of 2020, it's only 49.1%. And this could be due to influences such as private equity and hospital systems taking over practices. So in contrast, the share of physicians who were employed grew from 41.8% to 49.7% during the same period. So more people are looking to be an employee rather than employer. And then between 2012 and 2022, the share of physicians under the age of 45 who were self-employed actually fell by 13 percentage points from 44.3% to 31.7%. So us millennials and Gen Zs are definitely trying to avoid, I guess, more of the headaches of owning a practice. And being a millennial myself, I decided to ask ChatGPT, what is a group medical practice? So as you can see, ChatGPT, it's pretty much any, again, 2 or more physician-led or specialist-led practitioners. And this allows organizations to have that multidisciplinary approach to patient care. And every group practice can vary significantly in size, structure, and the specialties that they offer. Then I asked ChatGPT, so what are the pros and cons of group medical practice? So again, we will dive into the cons first of what ChatGPT will say, and also my feedback and insight on this. So number 1, less personalized care. So with a larger practice, patients might not always see the same provider. And this is very true because just like the hospital system, when you're in residency, there's always patient sign-offs and handoffs, and that applies to group practices as well. So for instance, in my practice, sometimes I'm in one office, my colleague who's also a gastroenterologist in another office. So we always want to try and give patients that continuity of care. And when you're in a group practice, it can definitely be more challenging. So this was just a study that's showing that practices consisting of 1 or 2 physicians actually had a 33% fewer preventable hospital admission rates compared to practices with those of 10 to 19 physicians. So it shows that maybe that the continuum of care really does matter more in terms of better patient care and also preventable hospital admissions, which a lot of insurance companies are looking at, just because anytime a patient goes to a hospital, it can be very costly. Complex scheduling. So the more bigger your office is or the group is, of course, anytime a patient calls the office, right, you always get that automated delivery or messaging system, and it can be quite challenging for especially the elderly patients to really navigate that and get what they need to do. So again, that kind of is group practice dependent, but then of course, when you have multiple providers and specialists involved, it can again be a challenge. So this study showed that the average wait for an appointment with a physician for new patients is actually 26 days, and this is according to a 2022 survey of 50 metropolitan areas. So we may not have that same problem in New York, but definitely in other areas, particularly more rural areas, this can be an issue. And then we run into the risk of over referral. So there's the possibility of over referral to specialists within the group, which might not always be necessary. And this could lead to increased healthcare costs and potentially unnecessary treatments. So based on this study from Harvard, it showed that primary care doctors under more of a vertical relationship with the specialists and the hospital system, there was actually a 23% increase in specialist visits and a 14% increase in ER visits. And that translated into a $357 in total medical expenditures per patient per year, which is a 6.26% increase versus the comparison group. And hospitalizations were actually 22% higher among those doctors in the vertical relationship. And then, as we mentioned before, there are the communication challenges. So again, when there's more doctors and providers involved, we want to ensure that there's effective communication. And miscommunication can lead to delays or errors in patient care. So this study showed that they investigated 23,000 medical malpractice lawsuits, and they found that about a third of those lawsuits could be attributed to communication failures. And that translated to a $1.7 billion in malpractice costs and almost 2,000 preventable deaths. So a study conducted by the Joint Commission found that 80% of serious medical errors were the result of miscommunication between caregivers. So definitely something to keep in mind in terms of group medical practices. And then, of course, this is higher cost. So this is kind of 50-50 depending on the situation. So definitely group practice can offer more cost efficiencies. The overhead with running a larger practice, obviously, there will be more costs involved. And depending on that group practice as well, the technology that you're trying to incorporate can be more than solo practices. So those were ChatGPT's feedback. So these are kind of my feedbacks. So other kinds of group practice is freedom of autonomy. So you really lose that autonomy when you're involved with other physicians and practitioners. So you really need to find the right team that works for you. There's the fact of increased liability. So when you have more practitioners involved, you know, if one practitioner is a little bit more courageous than others, one more willing to give different medications and procedural wise, right? If one practitioner makes possibly a mistake, then you may be liable as well when they look into it. Then there comes income sharing. So every group practice has its own model for income sharing. So of course there's RVU based, there's equity percentage, there's partnerships. So these are some things to keep in mind. And of course, there's relationship with other providers. You know, we don't really get along with everybody per se. So if you do have that person that you don't really get along with or don't really see eye to eye with, then this can be a potential issue as well. So now let's move on to the pros. So for the pros, as Dr. Chen may have mentioned earlier, is the comprehensive care model, right? So with various specialists working together, patients can receive comprehensive care under one roof. And this multidisciplinary approach is beneficial for patients, especially the elderly with multiple medical comorbidities. So this study was done in Taiwan. They looked at the potential patient loyalty, and they did find that physician practices that incorporated a multidisciplinary approach, they did find that the reliability, responsiveness, assurance, and empathy was greater. And then we're going to talk about access to services. So group practices often have the resources to offer a wider range of services from primary care to specialized procedures. So when you have that multidisciplinary approach, of course, it can make the doctor's life easy as well. For instance, I remember when I was working under the multidisciplinary group, anytime I needed a cardiology evaluation or the oncology evaluation, I can just get them on the phone right away and then speak to them about the patient. And this is just a survey or a research study showing the ability of primary care physicians to get services for their patients. And there's a percentage of PCPs unable to get the following for their patients. So for mental health is actually quite high, 66.8%. Specialists, 33.8%, high quality imaging services, close to 30%, and non-emergency hospital admissions, close to 17%. So with group practices, there's the enhanced patient convenience. So group practices often have the resources to offer a wider range of services. They have more capital to invest in other ancillary services, again, from whether it's primary care to specialized procedures. This can improve patient access to necessary treatments without the need for external referrals. So this study looked at pediatric ambulatory clinics, and it just showed that patients were more satisfied when number one, they cared about patient care, then their care team communications, and then when you add in these other factors, patients were more satisfied. And then comes the collaborative decision making. Again, when you have all the doctors and resources available, whether it's the surgeon, whether it's the oncologist, we can almost have our own things such as like tumor board, where we can all chip in and what's the best course of management for the patient. So healthcare providers in the group setting can easily consult with colleagues, leading to a more informed diagnostic and treatment decision. And this collaborative environment fosters a team-based approach to patient care. And then in terms of group medical practice, again, comes the economies of scale. So group practices can achieve cost efficiencies by sharing overhead expenses, such as the rent, utility, and equipment, and administrative functions. So this research study showed that overhead expenses made up, such as these things listed, made up about 60% of the revenue for an office. So of course, there comes the total support staff costs, the supplies, the facility expenses, billing, promotion and marketing, operation costs. So those were again ChatGPT's recommendations, and then these are my own personal pros of group practice. So you always want to have that work-life balance, which is very important. So when it comes to group practices, you always have that other person to cover you when you're not physically there. So you can definitely take your vacations. And then comes payer negotiation. When you have more physicians under your umbrella, you can definitely negotiate with insurance companies for higher reimbursement rates. And then comes the ancillary services. So if you're a large enough group, you can have your own facilities such as laboratories and possibly ambulatory surgery centers. And this study showed that 47% of healthcare organizations generate revenue from Medicare ancillary services, and they use those funds usually to pay overhead, productivity bonuses, profit sharing, to name a few. And then, of course, private equity. So the larger you are, the more attractive you may be to private equity. So it all comes down to the revenue that's coming in, the account receivables. So that's definitely something that's to think about. And as the healthcare landscape kind of evolves, again, hospital systems and private equities are buying up medical practices at a rapid pace. And this just states that why doctors are selling. It could be due to all the lower reimbursement rates that as solo practitioners, it's becoming more of a real issue. Insurances are cutting down reimbursement rates every year, and then overhead expenses are rising. And it's harder and harder to find staff. So these are some of the headaches that a private practice practitioner will have to deal with. And to some point, it can definitely get overwhelming. So in summary, I think it really boils down to the team, the leadership involved, and if you get along and share those similar visions and goals as the leadership or your partners. Then, of course, it comes down to patient care. Which model do you believe can provide better delivery of services? Some practitioners feel that it's harder to work with others, whereas some are more open to working with others. So of course, we want to provide the best care possible for the patient. And then comes burnout, right? When you are a private practice owner, there's a lot of things to deal with, a lot of headaches, a lot of things outside your office hours that you have to manage. So in terms of group practice, you can definitely share those responsibilities. And in finances, again, how do you see the finances? Do you want to make decisions on where you spend things, when to open up a new practice, when to hire another physician? So those are things to also consider. And then the future. So again, as I mentioned, that the healthcare landscape is changing. I believe that the group practice, the future definitely could be brighter with private equity and hospital systems trying to buy out these practices. And you just have more bargaining power later on in the future and negotiating power to work with. And finally, ChatGPT. So after using ChatGPT, right, I feel that there could have been some of the things that it could consider. A lot of it was a little bit repetitive, but in terms of AI itself, I feel that the future of medicine is really evolving, and we have to be on top of the AI before it controls us. We have to control it before it controls us. And thank you. Any questions?